Welcome back to another episode of Black Facts. Today we're going to be talking about sugar therapy. I'd like to introduce my guest, Mr. Edward T. Goodman III. He's a physical therapist for over 38 years, and he has a business with his wife, Donna. They run the Lifestyle Therapeutix, an outpatient physical therapy wellness clinic in Huntsville, Alabama. Welcome, Edward.
I'm so glad to be here, Michelle.
Oh, I'm so happy to have you. I just wanted to talk to you about sugar therapy. So, I watched a recent episode of a documentary. It's called A Touch of Sugar, and it addressed the diabetic or diabetes epidemic amongst the Black community in the United States. And so, I wanted to talk about diabetes, which our community lovingly or non lovingly refers to as sugar,
Yeah.
and talk to you about how it's killing our community. And if you can share some of the factors as to why it's devastating our community in such a major way.
Well, first of all, I am very glad to be here to be able to share some information and to be able to talk to you about some things that are near and dear to my heart. Uh, I, I realize that many times in the Black community, we don't get all the information that we could. And when you look at what's going on in our community, I like to narrow it down to three specific things, and I call them the three C's: carbohydrates, the cause, and the culture.
Oh,
Number one, carbohydrates. Many people look at carbohydrates as being a bad thing. Oh, I can't have carbs. I can't have carbs. And we look at them as being bad because they lump the good carbs in with the bad carbs. Bad carbs are your processed foods, your ice cream and your cakes and your pies and your potato chips.
oh,
But your
that's
good carbs are things that we should eat. Things like your broccoli and your cauliflower, your string beans, your collard greens, your black eyed peas and rice. Those are your good carbs, sweet potatoes. And those are the things that we should eat. And I talk to people all the time and they share with me that I can't have carbs. Well, no, I don't want you to have the pies and the cakes and the cookies, but I do want you to eat those complex carbs that break down very slowly in the body, and it releases the sugar very slowly as well. So carbohydrates, that's a piece of misinformation.
okay.
The next cause of misinformation is the cause of diabetes.
Okay.
And many people look at it as too much sugar, when really it's too much fat in the system. Our cells have a semi-permeable membrane on them. And when that semi-permeable membrane is clogged with cholesterol or saturated fat, it prevents the glucose from leaving the bloodstream and getting inside the cell. And when that happens, of course, the blood glucose level is going to be elevated because the blood sugar is staying inside the blood and not getting into the cell. That's the second thing.
Okay.
And then the third one is culture. We eat good foods.
Yeah.
There's nobody that can cook better than Black folk. I'm telling you, okay? We're talking about collard greens, cornbread, black eyed peas, and rice, pound cake, all the things that we love to eat. We eat good food. It's just that those foods are made with bad ingredients.
Okay.
Whenever you have the animal products inside of them, that causes the problem.
Wow. Okay. So we have our carbs, our
Cause
cause, and our culture.
in our
The three
culture.
C's. Okay. I'm going to remember that:
Okay.
carbs, cause, and our culture. So, those are the three things that are negatively impacting or affecting us to have an overwhelming or
I
uh,
could probably put a fourth C on there.
okay. Give me a
A
fourth
fourth
C.
C would be couch potato
Oh,
because we don't get enough exercise.
okay.
What I found out in doing some of the research that I found is that sitting is the new smoking.
Yes,
Okay, and I guess you've heard that too. Because we're
absolutely.
sitting around and we're not moving as much as we should, many times that has a predisposition to cause us to have that diabetes because we're not working off that glucose. Just walking on a consistent basis will help to drive down our glucose level because our body needs the glucose to function. And just by exercising, that can draw that blood sugar down. In fact, one half hours worth of walking is about 10 units of insulin.
Oh, wow.
So if you were able to go out and walk for about 30 minutes, that is about the same as you taking 10 units of insulin to bring your blood sugar level down. So whether you're going to walk before your meal or after your meal, that walking is going to pull, because the large muscles of the body pull glucose from the bloodstream to help them work. And the more you walk, the lower your blood sugar goes.
Okay, so we need to remember throughout this episode that our four C's, our carbs, our causes, our culture, excuse me, and being a couch potato.
Being a couch
So
potato.
we need to work on those. Um, I know you specialize in treating diabetic neuropathy. Can you please explain what exactly is that?
Well, diabetic neuropathy is a very uncomfortable and sometimes painful condition of the hands and the feet.
Okay.
And there are four basic types of neuropathy. One is peripheral neuropathy. That's a blanket peripheral neuropathy that talks about abnormal sensations that are in the hands and in the feet as well. Then there's diabetic neuropathy. Diabetic neuropathy is a condition very similar to peripheral neuropathy, but basically it is a person who has diabetes. And the research shows that 50% of those who are crossing over from pre-diabetes to diabetic, 50% of those, when they make that transition, are already showing signs of neuropathy. And then once they've been diabetic for at least 5 years, 100% of them have symptoms and signs of neuropathy, which are burning, tingling, numbness, pins and needles, puffy feeling. All of these symptoms are things that go along with diabetic neuropathy. Then there's chemotherapy-induced peripheral neuropathy, and that one is specific to those who have been treated with chemotherapy medications. And there are some specific types of chemotherapy drugs that almost always cause those who receive them to have some form of neuropathy. And the chemotherapy-induced neuropathy is much more painful than all the other ones are. It seems to be from the people that I've had the opportunity of treating. And then the last one is autonomic neuropathy. That deals with the things that are things in our body that are systemic. In other words, your blood pressure, things that we can't control, blood pressure, your heart rate, sweating. So those are the four types of neuropathy. But when you deal with neuropathy is something that is most often a product of cholesterol and saturated fat. And we talked about that
Yes.
earlier.
One of our first C.
One of our first C's. And when we look at that cholesterol and saturated fat that clogs the artery, this is the artery. My artery is on the left because I don't eat anything that has animal products in it. So there's no way that I'm going to put animal products in my body. So my arteries are clear and clean. The person on the right, that artery is clogged with cholesterol and saturated fat. And that cholesterol and saturated fat comes from only one thing: animal products, whether it's meat, whether it's any kind of dairy or eggs. Those animal products are room temperature, or should I say at body temperature. They are hard at body temperature. They may be runny and pully and cheesy when you eat that cheese pizza, but once it gets inside, it turns hard in the arteries. And it's hard on the inside. It's also hard on the outside of the artery, which is called atherosclerosis.
You kind of hurt my feelings because you talked about cheese pizza.
I did. But, well, we'll talk about that when we get further on, about how you can make some adjustments with that.
Okay, so okay, you just explained to us very in depth about diabetic neuropathy. So with the clogged artery, is it pressing upon the nerve? Is that what's causing the pain or the tingling sensation?
When you have that clogged artery on the right-hand side, that clogged artery is decreasing the amount of blood flow going down into the extremity, down into the feet and down into the ankles. And there are some people who are very far advanced and they have the painful sensations not only in the soles of their feet, but I've had some patients where the numbness has gone up as high as the knees. So they have zero sensation. I'm touching their legs from their knees down, and they can't feel anything from
Wow.
their knees down. So the clogging can be so impactful that it's not only causing neuropathy in the feet and the toes, it's causing neuropathy going up into the calf, the mid calf, and even higher. So what's happening is the narrowing of the artery because of the cholesterol and the saturated fat is preventing the blood and the oxygen from getting down from the upper leg into the lower leg. So you have clogging of those arteries, and there's not enough blood, and blood carries the oxygen. So you're not able to get that oxygen to the tissue in the feet, and also the oxygen to the nerves. There's a condition called hypoxia, and that condition is a lack of oxygen to the tissues and to the nerves. And if the nerves are not getting all of the oxygen that they need, they can't transmit the symptoms and the stimuli coming from the feet and the legs as well as they should. So that's where you have that burning and the numbness and the tingling, because they're not getting adequate signals coming to the brain, and it's coming to the brain as burning and as tingling and as numbness and as clubfoot. So that's the physiological reason why that clogging of the arteries is so important for us to begin to reverse, to be able to get them back to where they can have feelings that are more normal for them.
So, what are some treatments for diabetics experiencing neuropathy? Because I mean, I can only imagine how painful it is to walk around with a burning or tingling sensation in your, in your feet, like
Yep,
all day long.
yep. Well, when you look at the conventional treatments for diabetic neuropathy, chemotherapy-induced neuropathy, peripheral neuropathy, when you deal with those types of neuropathies, 9 times out of 10, the doctor is going to pull out his prescription pad and he's going to write a prescription for you. And that's the normal way that we deal with it. And
So
sometimes those
you're saying through medication.
through medication,
It's
yes, yes.
conventionally treated through medication. Okay.
Conventionally treated through medication. And that's the normal way. You have gabapentin, you have Neurontin. Those are your top 2 medications that they use for treating your neuropathy pain. And that's all that they're treating. They're treating the neuropathy pain.
What are some treatments?
Okay.
Because you talked about the conventional treatments using medication, but I want to talk about, treatments that you've introduced me to.
Okay.
I'm not diabetic, but I do know that you have shared some treatments with me so that I can
Yes.
share with some of my friends and family members that are diabetic.
Yes. Well, there's another acronym that goes with that as well. And I want to call that HEAT, HEET.
Okay.
Okay. The first treatment that we like to work with patients is hydrotherapy.
Okay.
Hydrotherapy is water therapy. And when we deal with water therapy, many people think about, of course, pool therapy, getting into the pool and walking around and doing exercises in the pool. That's pool therapy. Hydrotherapy is done with hydrotherapy tanks. I have 2 tanks in my clinic, and I have one with warm water and one with cold water. Excuse me. And when we come in, that's a significant part of our treatment, where we are going to be putting their feet and legs into one of those tanks for a period of time. And then we're going to go from that one to the other tank, which is a cold tank. And between those 2 tanks, we have 4 to 5 cycles going back and forth to be able to help them to improve their circulation. And when we put it into the warm water causes the arteries to dilate or to get larger. And the cold, of course, causes it to contract. Now, remember when I talked about arteriosclerosis and atherosclerosis? But atherosclerosis is hardening of the arteries. When there's cholesterol and saturated fat on the inside of the artery, there's also cholesterol and saturated fat on the outside of the artery.
Okay.
On the outside, the atherosclerosis causes the arteries to be very hard and stiff. So when we put their feet into the warm water, it opens those arteries, it pushes them open, makes them become more flexible. And then we put it into the cold, it causes them to contract, and it makes the muscles of the artery work more. And when they begin to work more, whenever you work a muscle, what does it do? It gets bigger.
Right.
And when you exercise the muscles of the artery that have not been exercised for quite some time, they now begin to be more flexible, and they can open wider and close tighter. And when we do that several times, that allows them to be able to have good blood flow to be pushed down into the artery. So the first treatment that we use, the first aspect of the treatment is the H.
The hydrotherapy.
Hydrotherapy.
Okay.
The next part of that is E, stands for exercise.
Oh.
We like to give them lots of exercise specific to the lower extremities.
Okay.
For the feet, for the toes, for the ankles, and for the lower part of the leg. So we give specific exercises without going in all the detail, specific exercises that help to increase the circulation of the lower extremities. And we normally do that right before we get into the hydrotherapy so that we can get the blood flowing, so that when they get into the hydrotherapy, the warm and the cool water helps to enhance what's already begun. Okay, so we have H for hydrotherapy, E for exercise. The other E is what you eat. And we talked about that already when you said that I've been stepping on your toes because you were talking about pizza.
Not pizza.
Well, there are alternatives to that. When we talk about what you eat, my staff, my wife is she has a master's in public health, and she is our nutritionist. And we have lots of sampling that goes on in the clinic. So we teach you how you can transition away from some of the things that are not that healthy for you to eat. So we actually talk about what you're eating. Okay, so that's a significant part. So this past week, was it this week? Yes. This past week, my wife and I and our staff, we had a cheese pizza that came from Trader Joe's, and it was vegan cheese, and it was very good. And on that vegan cheese pizza, it had plant-based meat, plant-based pepperoni, plant-based hamburger, plant-based sausage, and it tasted very good. Okay. When you go to Pizza Hut these days, Pizza Hut has Beyond Meat sausage on it.
Yes.
Mellow Mushroom. I'm not sure whether you've heard about that restaurant. They have a vegan cheese pizza. So we can get the same type of gooey, loving taste of cheese. When we talk about the ice cream, Haagen-Dazs makes plant-based ice cream. Yes. I think Ben & Jerry's makes plant-based ice cream. So we can get the types of foods that we like to eat. Let's just do it in a healthier way.
So what you're telling me, Edward, is that I can still eat the stuff that I love to eat,
yes,
but I can replace it with a plant-based option.
Replace it with a plant-based.
I will reduce my animal intake, which will reduce the I guess the level or the amount of fatty, carbs that I'm ingesting. That I'm ingesting, and that will help if I am. Well, that will help if I'm diabetic, or even if I'm not diabetic.
That helps with the diabetic. And if you begin to make that transition right now, then you won't cross over into being diabetic. Okay. Because you remember I said that diabetes is more a situation of a fat situation than there is a sugar situation. Fat clogs those cells, and when it clogs those cells, it prevents the glucose from going from the bloodstream to the cells. So we have H, E, E, and then the last letter is T. We teach about lifestyle. We teach about lifestyle. Okay. And that's, when we talk about the dietary side, that's only one part of the picture as far as a person's overall health. When you look at the other aspects of a person's lifestyle, that's important for us to talk about with them as well. And when I say that, I mean, are you getting enough rest? If you're not getting enough rest, then your body can't process your glucose as well as it should. If you're not getting any exercise on a regular basis, where many times when a person with diabetic neuropathy comes into the clinic, they're not walking. They're not doing any kind of exercise.
Wow.
So many times I am having to put together an exercise program that fits their lifestyle so that they can begin to become more active. And just by becoming more active, that's going to help to take that blood sugar down. Another thing is spending time outside. I recommend that when people do their exercise, that they don't go to a gym. Number one, gyms cost money. And number two, you have to drive to get there. They cost money to become a part of it. And then you have to drive money, spending money to be able to get to it. And then you have to buy clothes. You know, you can't go into a gym looking halfway, you know, sorry. You've got to get the best clothes to put on there. So it's going to cost you money to go to the gym. I recommend that people just get a pair of sneakers, and you can walk out inside of your own neighborhood. And even I had a video that I showed to many of our patients. And it shows a lady who lost over 150 pounds.
Oh, wow.
By walking in her apartment. She had I think it was between an 800 or 1,000 square foot apartment. And she walked back and forth in that apartment about 30 minutes in the morning and 30 minutes in the afternoon.
Wow.
So you never say that I don't have any place to walk.
Right.
You may not walk in the neighborhood, but you can walk in your house and you're safe in your house. Right. So she did that. She walked 1 hour per day in her house and lost 150 pounds, got off of all of her medications, blood pressure, diabetic, cholesterol medication, got off of all of that because she changed her diet and she walked in her home. So teaching them about the overall picture of lifestyle. And when you exercise outside, you get fresh air and you get sunshine. Sunshine is important because it gives you vitamin D, but when sunshine hits your skin, it changes cholesterol into vitamin D.
Oh, okay.
Okay. And that's only from 1 square inch of your skin for 15 minutes. That gives you all the vitamin D that you need. But when your body is exposed, your face and your hands, if you happen to be wearing shorts, that is allowing your full body to have access to the sun. And as it breaks down the cholesterol, it turns cholesterol into vitamin D. That's a more advanced process to try to explain. But in a nutshell, yes, it changes cholesterol into vitamin D. And that gives you the opportunity of getting more for your bang. And then the other thing is, when you're outside, the sunlight comes into your eye and it goes back to the pineal gland where the hormone melatonin is produced. So the more time you spend outside, the more melatonin is produced, and that will help you to sleep at night so that you can get the rest that you need. So we have hydrotherapy H, exercise E, what you eat is E, and T is teaching the full lifestyle. So that's what we try to do at our clinic, to be able to show them how they can make success with their particular treatment process as far as diabetic neuropathy.
Okay, I like the HEAT because that's an easy acronym for anybody. Those that are watching, for them to be able to remember. But explain this to me. Why can't I do that all at home? Why do I need to come into, and see a professional as yourself? Why would I need to go to a physical therapist to do that when I can dip my feet in hot and cold water? I can change the way I'm eating. I can exercise on my own, and I don't know. You just told me what I need to do as far as, teaching. So
right. So saying, why can't you do that on your own?
Yes. Why can't I do that on my own?
If you have the information and you understand what you're doing, yes, you can. There's 2 reasons. Well, actually, there's 3 reasons why I recommend coming to a therapist. Me specifically. The hot and cold, many doctors don't recommend patients putting hot on their feet because they could burn because they have insensitive limbs. That neuropathy means that it's numb. So we wouldn't want them to put their feet into hot water without having thorough understanding of exactly what they're doing. So the hydrotherapy part, that's something we do in the clinic specifically because we are monitoring the temperatures and we slowly increase them. We slowly decrease the cold. So we don't want to have someone trying this on their own by putting their feet into hot and cold. If it was as easy as you getting the information and following through with it, then we wouldn't have need of doctors really, because the doctors try to tell you that all the time. That they say, doctor, you need to exercise, you need to change your diet, but nobody is teaching them how to do it.
Right.
And that's where our clinic comes in place. Many doctors tell their patients that this is what I want you to do, but they don't give them specifics about that. And the second reason why they should come to me or to a physical therapist is because when you go to a doctor, you see that doctor one time per month, maybe. If they're having to check you for some specific things, you may see them once a month. If you're not checking them very often, you may see them once a quarter.
Right.
When I see a patient, I'm going to see them 2 to 3 times per week.
Oh, wow.
So when I have them in the hydrotherapy treatment and we're getting them treated during that particular time, I have them captive for 1 hour, 2 to 3 times a week. And they're in the clinic, and we're able to show them how they can cook certain things. We're able to have consultations with them. So we are able to develop a relationship. We're able to help them to make the changes that they need to make. And we can answer questions immediately that they may have, instead of having to wait until the next week or the next month when I go back to the doctor. And the doctors just don't have time. How much time does someone spend when they go to the doctor's office? I've had patients come to me and tell me he may have spent 2 minutes in my room talking to me. And you can't explain much in 2 minutes. It just doesn't.
It's kind of like you can sign up to work with you and get your own little personal health coach.
You can go up. Yes, you can. Yes, you can. And then the third reason is, when we talk about trying to help people make changes, many times you have to find out what stage of change they're in.
Yes.
If a person is not ready to make changes, then you've got to deal with them at the stage where they are. Contemplation, pre-contemplation, preparation, those stages of change. And someone may be in one stage and you want them to be in this stage. And there's a process of getting that person to be willing to move from stage 1 to stage 2, to move from stage 2 to stage 3. We have some patients who don't want to make changes. So we have to deal with them where they are.
Right.
But then there are those who do want to make some changes, and they may want to make small changes. Every now and then we find a patient who understands completely what we're saying to them, and they're willing to make all the changes. We've had several patients who have gone fully plant-based and adopted everything that we ask, and their numbers turn around, everything. In fact, we had a lady come back into the clinic this past week. In fact, it was yesterday. She came back in and she says, from what you all share with me, from what you all talk to me about, my kidneys were going downhill. But when I changed my diet and began to exercise, my kidney disease began to stop and it began to reverse itself. We've had patients who had poor vision because the blood vessels going to the eyes were clogged by cholesterol and saturated fat. Their doctor said that their vision improved 50%. This particular patient was on his way to dialysis. If he hadn't had something to change the process and interrupt that process, and when he changed his diet and lifestyle, his kidneys began to improve. So lifestyle is probably one of the best things that you can do to be able to correct your health issues. But most people don't have the understanding. And that's why when they come to our clinic, that's why we call it Lifestyle Therapeutix Wellness Center, Lifestyle Therapeutix.
Yes.
That's the main reason why.
Lifestyle.
Yes,
and
ma'am.
Learning how to adopt.
Learning how to
lifestyle.
Yep.
So I think you've answered my next question. I was going to ask you, can you reverse type 2 diabetes?
In a simple answer, yes. There's a group called Weimar Institute from Weimar, California. They're a lifestyle center there. And for years, I'm not sure if they still have it going on now, but I think in my resources, I have them down as one of the resources. But they were traveling around the country and they were having reversing diabetes weekends where they would teach people how to reverse their diabetes in one weekend. When my wife came back from her diagnosis with breast cancer, and she went to Wildwood Lifestyle Center and Hospital, which is another place that also reverses diabetes. She came back and she says, Eddie, I want to teach these principles to the city of Atlanta. So we opened up a lifestyle center there in Atlanta. And for 8 years, we had a 2.5 day program that diabetics would come,
Wow.
and we would teach them how to adopt a healthful lifestyle. And usually in 2.5 days, 90% of them were able to decrease their um, um, need for insulin and diabetic medication by between 85 and 90%. Some of them got off of their medications, and many of them decreased it so much that they learned the principles that we taught them, and they were able to get to the point where their, their need for medication was not as great. So yes, it happens very quickly if you're willing to make the changes.
Okay. Okay. So, do you have any other final thoughts or insights you'd like to share with our viewing audience?
Well, yes, ma'am. There is a quote by this illustrious, beautiful woman, my wife, Donna Goodman. She wrote a book, Something to Shout About, that chronicled her uh, bout with cancer and what she did to treat her cancer with the help of Wildwood Lifestyle Center. And she says that lifestyle is probably the most underprescribed medical treatment for chronic disease. Yet, when prescribed and faithfully applied, it is the most powerful medical treatment available, and it has no negative side effects.
Wow.
That's the ultimate. When you can change your lifestyle, when you can reverse chronic diseases. I'd love to come on and talk about what we do with arthritis patients, but that's a whole nother show. Uh,
We'll have to have you back.
huh?
We'll have to have you back.
I'll give you a teaser. I'll give you a teaser. We've had several patients that have come in with scheduled total hip and total knee patients, total knee surgery. And within 2.5 weeks, they got to the point where they canceled it. That's just a teaser. We'll talk about that later.
We'll have to have you back so we
All right.
can talk about arthritis at another episode. But
Okay.
I just want to thank you. I want to thank you for that amazing quote. It's so true. Lifestyle is everything, and if you don't have a healthy lifestyle, um, you can't live healthy, and you can't live, a long life, if you don't adopt a healthy lifestyle. And I just want to impress upon those that are watching, it's not too late to change. This is, we always have an opportunity if we're given another day to make that day count and do
Right.
better, right?
Right.
So all of you listening, if you have diabetes or if you don't have diabetes, just look at this as an opportunity. We all can learn something. I learned so much on this episode. So we all can learn things that we can adopt in our lives to live a healthier and a better lifestyle. So I just want to thank you again, Edward, for coming on and sharing your knowledge and helping us understand the things that, first of all, what diabetes is, what diabetic neuropathy is, and how we can reverse,
Yeah.
if you are diagnosed with type 2 diabetes, how you can reverse things. So there is hope, right? There is
Yes, there
hope,
is. Yes,
and
there is.
lifestyle is the key. So thank you again for joining us on this episode of Black Facts.